Joining us now is In Focus health reporter Linord Moudou for the latest news, or rather the latest, on swine flu.
Yes, indeed. Swine flu is really at the forefront with health right now. And as we reported earlier, the World Health Organization has raised the pandemic alert on swine influenza to level 5, just below what's considered a global pandemic. Voice of America's Melinda Smith has details.
At a late evening news conference in Geneva, the World Health Organization's Director General, Dr. Margaret Chan, explained what the change from a pandemic level of 4 to 5 means.
This change to a higher phase of alert is a signal to governments, to ministries of health and other ministries, to the pharmaceutical industry and the business community, that certain actions now should be undertaken with increased urgency and at an accelerated pace.
At present, there is no vaccine available for the strain of swine flu which has spread from Mexico. The WHO has asked drug manufacturers to help create a vaccine and to ramp up production of antiviral medications. Global health officials have been recommending that patients with mild cases of the influenza be treated with Tamiflu and Relenza, 2 current antiviral drugs. The World Health Organization says it still has a stockpile of medicines.
We'll keep that stock available to be dispersed to countries in need. But clearly that's not enough.
The WHO's expert on influenza, Dr. Keiji Fukuda, says he does not rule out changing the alert to the highest level, a 6, which means there are widespread outbreaks in more than one region of the world. Dr. Fukuda says as long as people travel from one country to another, there will be global disease.
Many of the travelers that you see returning to different countries have been visiting one country or another and are returning. So I think at this point it is possible that we will move to seeing established transmission in other countries relatively quickly.
The closing of borders is not recommended by the World Health Organization, and it does not feel a warning against eating pork is needed, as long as it is cooked properly. Dr. Chan made a plea for international cooperation.
After all, it really is all of humanity that is under threat during a pandemic.
Melinda Smith, VOA News.
Here in the United States, there is widespread concern that the number of swine flu cases could spread, and authorities in several states are taking precautions. Voice of America's Rob Raffaeli has more on that.
Thousands of school children in the U.S. have been sent home as fear of swine flu spread across the country and new cases were confirmed. Most of the school closings are in Texas, where more than 50,000 students are at home. On Wednesday, U.S. health officials announced that a 23-month-old Mexican boy who had traveled to Texas died from the disease, becoming the first U.S. fatality. But Dr. Jeffrey Stark said the boy's death should not spark alarm in the U.S. At the White House Wednesday, President Obama said his administration is doing everything possible to deal with the outbreak. He urged local jurisdictions to be vigilant.
It's also the recommendation of our public health officials that schools with confirmed or suspected cases of H1N1 should strongly consider temporarily closing so that we can be as safe as possible.
I, Kathleen Sebelius, do solemnly swear.
Late Tuesday, Kathleen Sebelius was sworn in as Secretary of Health and Human Services after being confirmed by the U.S. Senate. Some senators are suggesting that the Obama administration should consider closing the U.S.-Mexico border. But at a Senate hearing Wednesday, Homeland Security Chief Janet Napolitano said there is no proof that would help.
Well, if the CDC told us that closing the border would have a significant impact on the prevention of disease within our country, I think that would be a highly relevant factor. But the analysis has been that closing ports, closing the border would not have that kind of preventive impact.
Admiral Ann Schuchat of the U.S. Centers for Disease Control and Prevention said her agency is working to develop a virus strain for use in a vaccine against the swine flu.
If everything went great, production could lead to availability as early as September.
She said authorities would also have to determine which people could receive such a vaccine without suffering complications. Meantime, officials across the country had the same advice about prevention.
Keep your hands washed, cover your mouth when you cough, stay home from work if you are sick, keep your children home from school if they are sick.
Robert Raffel, VOA News.